essential tests to undertake during the first trimester of pregnancy. Hello, I am Dr. Sunil Kumar. I am a fetal radiologist with 14 years of experience in dealing pregnancy conditions. This video gives information on the lab tests a pregnant woman should undergo during the first trimester. Pregnancy is divided into 3 trimesters, with each trimester having a duration of at least 13 weeks. That means each trimester spans 3 months. The first trimester of pregnancy is till the completion of 13 weeks of gestation. When you are pregnant, you must remain healthy. Hence, it is essential to undertake tests to check the vitality of your body. The tests include a complete blood count, which is known as CBC. If hemoglobin level is less than 10 gram per deciliter, which indicates anemia that needs treatment with iron and vitamin supplements. A total blood count also gives information on white cells and platelet. The next test is blood group and Rh typing. Suppose the mother's blood group is negative and the husband's blood test is Rh positive. In that case, there is a chance for the baby to develop Rh incompatibility. In addition to the blood group, an indirect Coombs test is advised to check the level of Rh antibodies in the mother. A random blood sugar test is another important test to check the diabetes status. If the mother already has diabetes, then additional tests like fasting blood sugar, postprandial blood sugar, HbA1c and glucose tolerance tests are done to treat and monitor sugar levels. It is essential to check for thyroid hormone levels. During pregnancy, the thyroid hormone levels alter to meet the demand. Hence, it is crucial to get thyroid supplements based on the information from thyroid tests. Remember, if you have issues like thyroid, anemia, diabetes, it might affect you and your baby. Some other tests to check the infections are HBV test. If the hepatitis virus is present in the mother's blood, immunoglobulin injection and vaccine have to be given to the mother to prevent the transmission of infection to the baby. A VDRL or RPR test is to check for syphilis infection. HIV test is another important test to detect HIV infection. If the mother has HIV infection, it is essential to take appropriate measures to prevent disease transmission to the baby. A urine routine and microscopic tests are to check for urine infection. Suppose the urine report shows sugar and proteins. In that case, your doctor will advise for kidney function tests like blood urea and serum creatinine. Sometimes, doctors advise additional lab tests depending on the patient's condition. These tests are Rubella Igg Test to detect rubella infection, PTINR test to know the body's clotting mechanism, vitamin D test and vitamin B12 test to see the vitality of the body. Apart from these lab tests, an ultrasound scan is advised during the first trimester pregnancy. Suppose you are getting a scan before 10 weeks, in that case, the scan is called early pregnancy scan. The early pregnancy scan confirms pregnancy, locates the site of pregnancy and tells about the number of pregnancies inside the uterus. If you plan to get the scan after 10 weeks, it is better to get it between 12 weeks to 13 weeks. The scan done between 12 weeks to 13 weeks is called an NT scan or genetic sonogram. This scan identifies the risk of having Down syndrome in the baby. Along with an NT scan, a blood test known as double marker test is done simultaneously to understand the risk of chromosomal abnormalities. These are the basic essential tests you need to undertake during the first trimester of pregnancy. Make sure to take advice from your doctor if any of the test parameters are abnormal. I hope this information helps you to maintain good health during your pregnancy. I am Dr. Sunil Kumar signing off and see you in my next video. Thank you.